We have a couple of interesting cases. The first case is going to be with Petr Neuzil and Honza Petru, who are in the next lab, and they're going to show a visually guided laser balloon isolation case. So, Peter, do you want to take it away here?
So guys, we'll come in the smallest room in the world, and actually we are ready for answer the question of Joseph. He put on just the panel. So we have right now the X3 laser. This is a technology we are since 2004, I believe, and since 2009 the company involved like highly compliant balloon, and this catheter itself, X3, is available in Europe since 2018. So what is the catheter about? They serve much better flexibility in terms of manipulation. As a single operator, before then it was not so optimal to say the single operator, because you can touch these two buttons and inflate the balloon and deflate the balloon yourself. Then Honza Petru will show you the other possibility to manipulate with the laser beam, to adapt the laser beam on the area you are really in the contact. And rotation button, when you apply, there are two aspects of applications. There are manual application combined with so-called rapid mode or automated rotation. And actually the energy applied is adapted to all these modes. So we will show you, please can you give me the green light? And guys, can you get lights off a bit? Okay, this is visible, the balloon inflated. Actually the balloon size is up to 38 millimeters. I don't want to get the biggest size, but what I want to show you that you have nicely controlled the rotation of the laser beam, which is now green light and it's not danger, okay, so we can just visualize only. And Honza will rotate continuously to adapt, to show you, to mimic the automated rhythm of rotation. So the full circle is going around, and actually we have the case of, can you bring the lights on, please? Lights on and green light off, please. So we have a patient, a very young guy, 46 years old, with recent AFib in the history. So he matched the East AF criteria to treat his very recent proximal atrial fibrillation, actually with Shadwask 0, but he is on apixaban since they described, since I guess the beginning of this year, the AFib. So what we did up to now. So actually we have, we can show you what we did in actually regular distribution, regular anatomy of this patient. So we have CT done, but actually I don't want to show you because I really want to be focused only on this visualization. So actually you might know that the catheter, the system is equipped and it's going with 2 French endoscope. So actually this is a high quality endoscope which allows you to adapt the positioning up to your contact, and actually you adapt the contact, the sizing of the balloon, and actually what is more important, you can adapt the laser beam orientation actually in concert with phrenic nerve and with esophagus. So for all patients, what we are using right now, we have all patients with esophageal probe, temperature probe on site. So what we did on this guy, So actually with regular distribution of 4 veins, we did 2 lefts and right inferior one. And we will show you from the playback, so please focus on the laser console screen. If you can show, Matěj, the left superior vein. Actually, it will be a little bit shorter than usual, but it is continuous, automated, rapid mode rotation. We will rotate around. And actually, I will answer the Joseph question. Actually, this left superior vein was done in 190 seconds. And actually, it's very, very interesting when you get very, very high amount of contact. So you don't need to rotate the balloon as we learned from the previous smaller classic, so-called like HeartLight classic balloons. Because this Excalibur balloon really serves you very, very high contact. Actually, in the left vein, you can see on the right side that you can see not only the ridge, and you can just sometimes, depends on the sizing of the heart, you can even visualize the appendage itself. So, well, what we are doing here in Homolka, actually it's not always the same technique, but actually we like to get all veins isolated, actually to get around. So somebody is going only for the left sets of veins together without or excluding carina in between the veins. So we can go to the left inferior. So this is a very nice vision of the left inferior, and you can clearly see how big amount of contact you can get with that kind of balloon. And actually the laser beam is really placed specifically on the side of the really nice amount of tissue. So actually any charring, any other stuff, or floating blood could be excluded. What is the most dangerous part of the laser application is to heat inside the artery vein. So actually, if you lasing the stagnant blood inside the vein, so actually it's the most thrombogenic situation. So you need to avoid the laser beam should be really placed on the tissue contact. So the last vein we did is a right inferior one. Actually, you can clearly see the anatomy. So when the right inferior vein is branching early, so actually all the balloon clearly contain all this circumferential, even plus visualization, all these branches. So actually you can appreciate the visualization of the anatomy, which I like. And actually this vein was done in 110, 20, 30, 40, 50, 60, 177 seconds. And actually all 3 veins we did by single rotation without any manipulation of the catheter. So the only one vein we didn't treat is right superior one. So actually Honza already target right superior vein. So actually we can go less slide, please. And we can proceed now what we are doing. So first of all, we need to inflate the balloon. So actually, as I explained, we
can we have the screen of X-ray?
Push the bottom of the fluoro, actually the bottom of the catheter, and please show on the fluoro. I will give fluoro live. Actually, we don't like too much fluoro, but actually just to show you how nicely we inflating the balloon. And actually there's a marker on the shaft indicate the orientation of the shaft itself. So now on the laser screen, you can see very nicely the contact creation. So actually we need to reach, to get ideal contact, we need to reach actually some kind of angulation, because angulation could help. Actually, the catheter itself is not deflectable, but actually we really play with the sheet, which is helping us to manipulate and nicely oriented the catheter itself. So right now, what I like to go the sheet in the back of the laser balloon, and this kind of balloon is a little bit robust than classic Excalibur, which serves you more freedom to heat through the tissue. So I think, Honza, are you happy with this?
Yeah, almost, yeah.
So I'm not so, actually, can we increase? Okay, now it's going, sometimes it's better to just pull the balloon outside the vein, and now it's really nice positioning. So what I explained, so actually now we have shaft on the posterior wall, and all the facing left is anterior part, and superior inferior is down. So actually we are ready to apply the beam. So I will play with the beam. Actually, can I get this? Mm-hmm. Okay, perfect. So it's a pedal you can control, and we will start hopefully with. Can we go up? Mm-hmm. Okay, perfect. Nice. So can you go less slide, guys?
So we can go.
Okay, it's too much.
So we can go even behind the shaft.
Okay.
And let's start.
And actually,
counterclockwise.
We can adapt prior application. We can adapt the laser beam orientation if we can apply really under the shaft. So actually, I rotate manually with the bottom. So I did manual rotation, and I will show you. Actually, all the circumferential is easily to apply. So, what do you want to go? Counterclockwise or clockwise?
I will go counterclockwise.
Counterclockwise. Okay, so we will start here. No, we will start here. No, we will start here and go counterclockwise. Actually, you have two options: clockwise, counterclockwise. And actually, in any single minute, you can stop and you can switch to the manual mode, which is sometimes better because you can apply less energy if you have poor contact of the tissue. So, guys, so I will start with 13 watts. Actually, what is important, we are on right superior vein, so actually we need to get phrenic nerve pacing. So can we go for capture?
Pacing, capture.
Okay, so it's capturing. Okay, so we'll go through all the vein, actually phrenic nerve pacing. So I will start, guys, so you will see. Actually, before I start, I will explain. So we have, for the rapid mode, two options, 13 watts and 15 watts, which is so-called equivalent of the other manual dosing. So actually, what we know from our own experience and the study, actually we showed the X3 study, that when we applied most of rapid mode for 13 watts, it's highly enough for all the veins to get isolated and to get durable isolation. Actually, if we have that kind of amount of contact, we have no problem to apply 15 watts. So please switch off 15 watts. And then immediately when we are going to less contact with the trachea, so we can just switch to the other mode. Okay, so guys.
You also comment on circa position or
actually
circa monitoring?
For all, I did already. So, and I can repeat it, for all patients we do for laser balloon ablation, every single patient, we have temperature monitor in the esophagus, and this is really like, it's AP position, so it's actually a very neutral position, like center position of the esophagus. So we didn't heat on the left side, and actually we are happy because we probably couldn't heat even from right side. So let's go. So actually I will start right in the rotation, and you will see right now the starting point. Okay, so start the application. The laser is on, so the table indicates clearly the seconds I'm applying, and actually you can see that timing and the laser beam. Actually on the right side veins, you can sometimes even visualize the blanching under the beam. Actually, in any single spot, you apply by, for example, 2 seconds. And actually, the beam, the rotation of the beam is very nice to. Okay, so now we can change for 13 because I really don't want to burn too much. And actually, what I would like to say, when I interrupt, I'm always going a little bit backward to get the continuity of the lesion. Actually, what is very highly advantage of this system, that the rapid mode, so-called rapid mode, really allowed you to take all the circumference of the vein. Actually, what I need to say, we have chosen for you, for the live case, the worst vein actually in this guy, because all other veins were much better in terms of contact. So I really want to show you the ability to rotate and to treat all the veins regardless on the anatomy. But actually, you can just see that the laser is coming on the actually the anterior. We have still capture of phrenic, so we pass the superior part of the vein. It's coming to the bottom of the vein, and it's now like 62, 63 seconds on the second part of the application. And we are going to be able, I hope, to ablate under the shaft. So I will stop right now, and let's check if we are going where we are going with this beam. Okay, so I will go a little bit closer. Okay, let's see what we have here. Okay, so we can really go under the shaft. So I will stay here very close, and then I can just by the bottom manipulate like proximal and distal position of the laser beam. Okay, so let's continue with 13. So it's automatically starting. So now the beam is going around. Actually, this is a 30 degrees laser beam. Now under the shaft is usually like some like time to not seeing anything, like when you go to atmosphere and you have some connection interruption, and Apollo 13 was visible. When I see the movie, I was a little bit thinking about this. So actually now I'm adapting the laser beam going a little bit closer inside to catch the good area of contact on the posterior wall of the left atrium. And actually now I'm going around, and I need to finish this 59, 60 seconds of non-visibility of the lesion. And now I'm coming back over the shaft and over the vein. So I will apply a little bit more, but actually we start here. So we finished this circumference of the vein nicely in 3 parts of the rapid mode. And actually what is really visible from the X3 study, actually we did with Boris Schmidt together, it's really with increasing patient numbers, we were able to treat more and more veins with the rapid mode only by one single circle. So right now we are ready for saying the true, and Honza is putting
deflating the balloon.
Actually deflating the balloon. So can you just show on the floor briefly? Okay, nice. So we are out of balloon. So what I like to do, because it's a little bit safety, so I really want to suck from the shaft and from the sheet back. Okay, don't do it too fast. Okay, be careful. We need to be careful about air embolization. So it's exactly what Peter Peichel said about all these big sheets. so you can get very nice energy or technology without any charring, without anything, but actually by the sheet manipulating, you can clearly get the small strokes or big strokes when you don't manipulate properly. So actually now it's time to say true. We did, actually I must say that we did all the baseline checking of the veins. So can we show the baseline measurements from the Prague guys or not? We are not able. Okay, so because of this, guys, the technical staff is not able to adapt our one-off screen, recording screen to the system. So we just can show you what we have as a current lasso or circumferential catheter recording. So now Honza is in left superior vein, which is clearly visible on
This should be the
eyes.
far field.
So actually, can they show even like eyes or not? I don't know. It's maybe this. Actually, just to visualize how far we are, or how inside or outside we are in terms of the level of isolation. Because when we remap all this laser Excalibur or X3 patients, so we were so amazed how far we are in terms of the level of isolation. Okay. So right now we are in very
this is the
osteo part of left superior, and actually let's go for the left inferior. Okay, again 0, like
so left inferior is perfect.
So left inferior is isolated. Please go to the right superior. Okay. And
this
0,
is inferior. This is the inferior one.
So it's inferior. It's okay. Can
this
show
is
it
the
better?
eyes picture.
Okay,
that
so
we are
it's
definitely in right inferior.
Okay, it's the right inferior vein with very nicely visible, and so no potential. Okay.
Okay.
Okay, and we have still some potentials on the right superior.
But it's very far field, so should we maybe try to pace from?
So can we justify this far field or the real stuff? Can you show me at least the baseline?
Zastavme prosím CS1-2. So let's pace CS1-2 just to exclude this far field from
right superior, right?
Right atrium.
It signals at the beginning of the P waves.
Can we pace CS1-2?
It's very early. It's potential.
CS1-2 pacing.
I mean, this should be real.
Can you pace faster?
Okay. How much how much output do you have? Okay, I think it's real.
So this should be far field. Yeah.
So.
That's good.
Okay. So, guys, what do you have? So actually, we are going to move to other lab. So, do you have any questions, Peppa or Robert, about?
How often after ablation you must go back with a balloon if there are one vein or more veins are not isolated?
Actually, it's very good question. We like to go with the same balloon. So actually, the touch-ups with RF. Actually, if you follow this all studies we publish, and actually Boris is very active. So Boris published. So the touch-ups are very infrequent. So we try to get with the laser. Actually, these are the veins. Usually with early branching, because there are some tricky anatomy when you cannot adapt properly. It means so-called early branching is one of the example when you have really tricky time to get good contact and good lasing. when we adapt the balloon and we are using, for example, the less energy we can, which is here 5.5 volts. Usually it's proved by preclinical series of animals. I did some, and actually Vivek did some. So we proved that the 5.5 volts you can apply even to the floating blood without any fear to get any thrombosis or any charring on the balloon. So actually usually when we have troubles with esophagus, we have sometimes problem to isolate the vein when we play, and actually we are limited by positioning of the laser beam. Sometimes we need to go too much inside, sometimes we need to go way outside to avoid all this esophageal heating, because our cutoff limit, or the upper limit, is 38.5 for laser, 39 degrees of Celsius. Okay, so this is actually this is my answer. I don't know if you are satisfied with that.
Yes, very satisfied. So thank you very much for this nice case.
So we can move to the other room, okay?
Yes, thank
And
you.
I
Thank you
hope that
very
they are
much.
ready for the nice stuff.
It was
Thanks.
a very
Bye-bye.
nice demonstration. Thanks a lot.